Speaker, I thank you for this treasure space to make the statement in accordance with the rules of this House. Mr. Speaker, World Hepatitis Day is celebrated every year on 28th of July, the birthday of Nobel Prize winner Baruch Samuel Blume, who uncovered the hepatitis B virus and created the first vaccination. Hepatitis B is the inflammation of the liver, which is caused by a number of factors, including autoimmune conditions, alcohol abuse, and viral infections. Hepatitis B, hepatitis, let's break it down, is a theme for the year 2025, and it's a call to seek urgent action in order to get rid of systemic, financial, and social barriers, including the stigma of hepatitis, which restricts access to prevention, testing, and the treatment of hepatitis B or C. It is estimated that 304 million people live with hepatitis around the world, and out of this number, 1.3 million people die each year due to liver cancer or cirrhosis. Mr. Speaker, hepatitis is a major public health threat in Ghana, and approximately 4 million Ghanaians live with hepatitis and are not even aware of it due to the lack of healthcare facilities in rural areas especially. In some regions, the prevalence of hepatitis C is much higher due to customs like sacrifices which may aid in the spread of the disease. Initially, Mr. Speaker, the viral hepatitis is usually silent. People may feel healthy while accidentally carrying and spreading the virus. They may only experience some symptoms like fatigue and jaundice after there has been a progression of the liver damage. Hepatitis B and C are the main causes of carcinoma in Ghana because chronic infection can result in a lifelong liver damage, cirrhosis, and ultimately liver cancer. People are discouraged from seeking testing or care because of stigma, false information, and myth, such as the belief that hepatitis is solely caused by alcohol consumption or contaminated food. This keeps the cycle of delayed diagnosis and concealed transmission going. Public ignorance, limited access to low-cost diagnosis and treatment, and uneven health care quality across regions, particularly in impoverished regions of our country, have all contributed to the situation in Ghana. Mr. Speaker, from the theme of this year, let's break it down. It's clear that we must confront this. We must break down the walls of ignorance, stigma, inaccessibility, and above all, costs, which continue to deny many citizens the opportunity to access proper diagnosis, care, and treatment. Health equity, Mr. Speaker, is not a luxury. It is a necessity. The Ifutu experience, a community that has moved into action. Mr. Speaker, in my own constituency, the realities of hepatitis B are not distant. We have witnessed heartbreaking stories. Mothers unable to afford immunoglobulin to protect their newborns, and promising young people succumbing to liver failure, dying far too early. As a member of parliament, I could not sit back and watch this trend continue. In 2023, I commissioned a constituency-wide health survey on hepatitis B, conducted in partnership with medical professionals. The findings were deeply alarming, revealing elevated prevalence rates, particularly among youth and pregnant women. It became clear to me that the cost of inaction was far too high. In response to this crisis, we launched the HepaGuard project, which has now become institutionalized as the Afenyo-Markin Care Foundation. I personally supported this initiative with an initial commitment of 1 million Ghana cedis to facilitate screening and vaccination of the people of Efutu through this project. Mr. Speaker, this Afenyo-Markin Care started in 2023. Over 20,000 individuals have been screened and vaccinated in the Efutu constituency. Hundreds of individuals have been initiated on treatment. Dozens of newborns have received free hepatitis B immunoglobulin to prevent mother-to-child transmission. And Mr. Speaker, to consolidate these efforts, construction is currently underway for a dedicated hepatitis B and liver care center in Efutu, the first of its kind in the region. Further, every 27th of May, which also marks my birthday, has been designated as Hepatitis B Awareness Day in Efutu. Mr. Speaker, while community efforts like these are commendable, they are not substitute for national policy action. More needs to be done. The broader national picture. 1. Hepatitis B continues to be a silent epidemic in Ghana. According to the WHO, 254 million people live with chronic hepatitis B globally, claiming over 1.1 million lives in 2022, largely from liver cancer, as already stated. Sub-Saharan Africa carries a disproportionate burden. Over 91 million people in the region are infected, and in 2019 alone, 125,000 deaths were recorded from hepatitis B and C. Worse still, 90% of those infected do not know their status, and someone dies every 30 seconds from hepatitis B, hepatitis-related complications. These are not just statistics. They are an urgent call to action. Mr. Speaker, here in Ghana, the statistics are no less sobering. According to the Ghana Health Service and WHO estimates, Ghana has an estimated prevalence rate of 12% for hepatitis B, with even higher rates recorded in some rural districts. It is further estimated that between 3 to 4.6 million Ghanaians live with chronic hepatitis B, often unaware of their status, as already stated supra. Worse still, up to 147 million newborns are exposed to the virus through mother-to-child transmission. The leading cause of intergenerational hepatitis B is spread in Ghana. Infected mothers with high-level loads have a 90% chance of passing the virus to their babies, many of whom go on to develop chronic hepatitis, irreversible liver damage, or liver cancer. The burden, Mr. Speaker, falls the heaviest on the vulnerable, pregnant women in rural communities, babies born into poverty, and families who are unable to afford viral load tests, liver function tests, or life-saving birth dose vaccines like HBIG. Today, many pregnant women are still not routinely tested for hepatitis B. Those who test positive are not supported with antiviral treatment to suppress the virus. Newborns cannot access hepatitis B, HBIG, or birth dose vaccines. These essential interventions remain unavailable or unaffordable as they are not covered by the National Health Insurance Scheme. This is an unacceptable gap, and this, Mr. Speaker, is what we must break down. Yes, Ghana has made some important strides. One, we have attained over 90% infant immunization coverage for hepatitis B. We have introduced free hepatitis C treatment. We have made antenatal hepatitis B testing mandatory. And we have developed a national viral hepatitis B control program framework. But framework and pilot interventions alone are not enough. Glaring gaps remain. As I speak, Ghana is yet to introduce the hepatitis B birth dose vaccine or make hepatitis B HBIG freely available or subsidized. The result is that the poor are left behind and the virus continued its silent destruction. Too many Ghanaians are still dying from the hepatitis B, not because treatment does not exist, but because it remains financially out of reach. Mr. Speaker, I dare say that the time for national action is now. While community-based interventions are essential, they are not sustainable without a national backing. The financial burden of hepatitis B treatment remains a heavy load, particularly on low-income Ghanaians. Antiviral medications cost between 300 to 600 Ghana cedi per month, with full treatment costs running into the thousands. Over time, this becomes an impossible burden for most households. So most patients go untreated, not by choice, but by circumstances. I reiterate a call I first made on this floor in 2023. Let us include hepatitis B treatment under NHIS coverage. We have done it for certain chronic conditions. We can and must do it for hepatitis B. Let us also expand free community screening and antenatal testing. Fund birth dose vaccine roll out and subsidize hepatitis B, HBIG. Launch a national hepatitis B awareness campaign to fight stigma and misinformation. Equip every regional hospital with dedicated liver care services. Mr. Speaker, I conclude. Let's break it down together. Mr. Speaker, the year's theme, let's break it down, is both bold invitation and a national mandate. Indeed, let's break the cost barrier through comprehensive NHI support. Let us break the stigma barrier through national education. Let us break the access barrier through targeted rural investment. Let us break the silence barrier through evidence-led, budget-backed policy. And on this, I call on this House, the Ministry of Health, the NHIA, and all health sector stakeholders, not to just recognize this day, but to take historic steps towards transforming hepatitis B care in Ghana. Let us protect Ghana as a leader on the African continent in the fight against viral hepatitis. Let us ensure that no child is born with this disease simply because their mother was poor and no adult dies silently for lack of affordable care. Let us break it down. Together, let's break it down for good. And Mr. Speaker, on this note, I would like to thank you for admitting this statement and also thank colleagues for indulging me. I'm grateful and I hereby resume my seat.